Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. With me today is Dr. Bryn Henderson, and we're going to be talking about morbid obesity and the difference of being just 10 pounds overweight and being 200 pounds, 300 pounds overweight is what we're seeing today, which is a catastrophe as far as I'm concerned. The thing that affected me most about how overweight America has become is going to Disneyland. And you would say, well, what could that have to do with weight? When I was a child in the 50s and I went to Disneyland, you would see maybe one overweight child. Everybody else was normal. When I brought my children to Disneyland when they were young, there would be one thin child. It completely reversed. It is a very, very serious problem that we have in America. There are new treatments. We're going to talk about them, but we're going to start with and explore what causes it, how it affects us, and most importantly, what we can do about it. I'm honored today to be joined by Dr. Bryn Henderson, a leader in regenerative and integrative medicine with years of experience treating chronic conditions and helping patients take charge of their health. I would also like to say the first time I met Dr. Henderson and shadowed him in his clinic, my mouth dropped open on the floor watching him practice medicine like no one else I had ever seen in my life. He is so cutting edge, but now I've got him here to bring his cutting edge information to you. So, Dr. Henderson, let's start with the fundamentals. How would you define morbid obesity?
Well, thank you for the compliments. Obesity is a chronic, multifactorial disease. It's characterized by excessive accumulation of body fat that impairs our health. It's usually measured by the body mass index, or the BMI, and that's being challenged today in other parts of the world as well. Any value over 30 qualifies as obese, but the concern isn't just the weight itself, it's what comes with it. The higher risk of heart disease, type 2 diabetes, sleep apnea, certain cancers for sure, and joint degeneration. Today, obesity affects millions globally, making it one of the most urgent public health crises of our time, just like Dr. PENSANTI taught us.
All right, so we know, everybody knows you can gain weight from overeating and not exercising, but what else?
Most common misconception is it's just eating. Lifestyle factors like poor diet and physical activity do contribute, but it's more complex than that. There's genetics, there's hormonal imbalances, there's psychological factors, even medications impact obesity. One interesting facet is how early life exposures in the womb can all play a role. There are also environmental and socioeconomic influences like access to healthy foods, opportunities for exercise, that shapes a person's long-term health.
All right, so you mentioned genetics. Could you tell us a little bit more about how our genes influence obesity?
Certainly. There are both monogenic and polygenic forms of obesity. Some people carry mutations in a single gene, that's mono, or that control hunger and metabolism, and others inherit small genetic variations from multiple genes, and that's polygenetic, which together increase your risk. For example, a gene variant is associated with increased appetite and a preference for calorie-dense foods. Genetic doesn't doom a person to obesity, but it does influence how easily someone gains or loses weight.
I think we know that we've seen people eat a loaf of bread and they're skinny as sticks and they don't gain a pound, and somebody else eats one piece of bread and they'll blow up into a balloon. So we all know that there's something going on inside each individual body. So you were talking about influences during pregnancy, early development. Now I'd like to know what you found out.
Well, extremely important. The first 1,000 days from conception to a child's second birthday are critical. If a mother is obese or develops gestational diabetes, it can create an environment in the womb that predisposes that child to obesity. High fat diets, nutrient imbalances, or exposure to toxins like BPA can affect fetal metabolism. These early life exposures can set the stage for weight issues later on.
Okay, so let's explain what BPA is. That is tossed around so much. Just hear it all the time on the news and on the media. What is BPA? I mean, I know it's a plastic, but
And
that's all I know.
that's a type of plastic,
Uh-huh.
and it's manufactured. And what happens is it's devastating to metabolism. Herein lies the origin that obesity treatment starts with lifestyle changes, healthy eating, physical activity, and behavioral therapy. But for many, that's not enough. Pharmacotherapy has become a powerful tool. Medications like the GLP-1 receptor agonists, such as a semaglutide or tirzepatide, help regulate diet, insulin, and metabolism. For those with severe obesity or multiple complications, bariatric surgery may be considered. The key to personalization, matching the treatment to the patient's needs and biology and other challenges.
All right, before we go into GLP-1s, let's do a little history of what we had before that didn't work. So we can go back, say, to the 50s, early 60s. Everybody was put, before fen-phen, they were put on amphetamines. And there's phentermine hydrochloride, 37.5 milligrams. I used in my practice in the 80s and 90s. That was all we had. And I finally gave up giving it because what happened was it only worked for 3 months. So they would lose like 30, 40 pounds, and then it would stop working and they gained double back. And I said, I'm not doing this to you. We're going to find something else. And then, just to give you a little history of my research, somewhere in, I would say, around 2010, I was reading in the New England Journal of Medicine. They did a study on fat mice, normal mice, and skinny mice. So what they did was they went into these mice, the fat ones, the thin ones, and the normal. They knew exactly the names of the bacteria that was in the stomach, and they published it. And I said, okay, all you have to do is get something that will kill off the bacteria that are making the mice super absorbers, or do it the other way. And then lo and behold, around 2018, I think they came out with Ozempic.
Yeah.
And little by little, people started losing weight, and then more and more labs started getting their own. So let's talk about GLP-1 receptor agonists and how do they help with weight loss?
They're a receptor agonist, which means they're a class of medications that mimic a natural hormone called glucagon. Glucagon like peptide.
Oh, GLP. How easy is that?
And it's easy.
Yeah.
They stimulate insulin, suppress glucagon, slow gastric emptying, and act on the brain to reduce appetite, the last of which is a major factor. The satiation center of our body is in the brain, and there are signals that go to that part of the brain to reduce our need to eat. In other words, it's not telling you eat more, it's actually saying you're not hungry.
You're full.
Yeah.
I'll just mention that there's 6 chemicals. So everybody knows Ozempic. Ozempic is the brand name. The other name for Ozempic is Wegovy. Tirzepatide is the generic name of Mounjaro or Zepbound. Those are weekly. And then you have a daily. One is called Saxenda, and its generic is called Victoza. So there's 6 different chemicals, I'll call it, that you can try. And the reason I'm telling you there's 6 is because I've been working with this for 2 years. And I'll have some patients that do not do well on Ozempic, but I could put them on tirzepatide and they'll lose 10 pounds a month. Some people get rashes. Some people get, oh, this one makes me nauseated. I don't like it. So you don't give up on it. If your doctor starts you on one of these injections, you can jump around. There's 6 to choose from until you find the one that works for you. So what I see in my practice, I don't know about you, is if I get a good injection and I get a good response, after it gets cooking, so to speak, they can lose 8 to 10 pounds a month. So who cannot take these injections? I'll tell you my hard nose. My hard nose is anybody who has any kind of thyroid issue. You're out. You'll have to go back to phentermine hydrochloride. You cannot take this. Or any kind of abdominal, intestinal, or colon issues. Because it slows down the digestion and you already have a problem in digestion, it's an accident waiting to happen.
I agree with that. And I think they're not suitable for everyone, which is why we individualize it with a history of certain medications and other things. Be so careful anytime somebody's taking any thyroid to make sure that we're not fanning a fire of malignancy.
Right.
Pancreatitis and severe GI issues are common, and that's when you avoid that one and switch to a different one.
Right.
Additionally, pregnancy, as in most things, is concerned to make sure we're not using any teratogenic, that means baby harming medication. I think it's common sense that a thorough medical evaluation by a healthcare professional is crucial before starting any major weight loss injections, and individual suitability is key.
Okay, so I mentioned my practice where I've seen someone with a red rash where the injection site is. Some people go, oh, I was nauseated all week. I can't do it, or something like that. What have you seen? Give me an example of one of your patients.
Well, I think there's 2 or 3 that stick out, one of which is the GI nausea, and another is the diarrhea, and the last is a rash. That's the 3 that we see most.
Okay. So let's have a clinical case study.
Okay, so we have a patient who's 65-year-old male and first presented not for weight loss, but for chronic bilateral knee pain. And that's very common. Knees don't like a whole bunch of weight. Imaging revealed that he had joint effusions. That means fluid from the joint had leaked out into the tissues, likely aggravated by the excess weight. He was 254 pounds and had a BMI of 32.65. And he was classified as morbidly obese. That's when we initiated our structured obesity protocol, combining the GLP-1 injections with a nutritional support, weight loss, and a good exercise program.
How did the patient do?
Well, he did extremely well. At first, the progress was modest. He lost a few pounds over several weeks, but he experienced some challenges, occasional weight gain, even nausea that forced us to temporarily halt the treatment. However, once we transitioned him to a newer GLP-1 called Manjaro, the response was dramatic. Within a month, he'd lost 25 pounds, bringing his BMI down to 29.76. And that moved him from morbid obesity to overweight.
What do you do with the nausea? I usually give them the Zofran. That's good enough.
And I do the identical medication. Some of them are already using over-the-counter medicines when they walk in the door.
If they have a rash at the injection site, it happens to be the medication that works. Does the patient ever say, I don't care if I have a rash, I want it? Or do you say, no, we don't want to go to anaphylactic shock?
We do it no, because the other thing is that means there's bonding going in there and it could block kidneys.
Oh.
And so it's important to tailor the treatment. It's not just the dosage, it's also the support internally that can do something.
For those of you that don't know or are curious, these injections are not like a diet pill. like the old black beauties I was talking about, the amphetamines or the phentermine hydrochloride, those things made you not want to eat. You didn't eat all day long. On these injections, you get hungry. You wake up in the morning and you want breakfast. But when you go to eat your normal breakfast, you'll eat half and you'll say, I'm full. And then lunch, the same thing. You'll get hungry at lunch. You eat your regular lunch, you're going to eat half. And so now what they're saying is they're trying to use it for alcoholics and drug addicts. How about that?
It's working for addictionology, which is both of the ones you mentioned. I've even had a addictionologist use it in gamblers.
Yeah?
Yeah, it's sort of crazy.
Wow. Okay. So let's say a person says, I don't want this chemical in my body. I don't want your phentermine hydrochloride. I don't want your Ozempic, your Mounjaro, your tirzepatide, your Victoza. I don't want any of that. You help me lose weight the good old-fashioned way. But wait a minute, we've got something else that we can pull out.
Yeah.
And what would that be?
That's the traditional Chinese medicine, which is very applicable here because it uses acupuncture and meridian therapy to regulate metabolism. Acupoints, ST36 and CV12, have shown measurable reductions in body weight. In addition, the regenerative therapies like stem cell treatments are under investigation that highlight our body's ability to regulate metabolism itself, reduce inflammation, improve insulin sensitivity, and definitely promote fat burning by enhancing brown fat activity.
Okay, so you're telling me that acupuncture can help someone lose weight?
Absolutely.
You've seen it?
Yes, I have. So obesity can be viewed as an impairment in the function of metabolism.
So we always have to think when you're losing weight, it impacts your friends, your family, and everybody around you.
Absolutely. The patient here then that we previously mentioned reported improved mobility, reduced joint pain after losing all that weight, and improved energy levels. Even had financial benefits,
right?
Because his reduced food intake.
So financially, you're going to be saving money on your food bill.
Sure, and that benefits the entire family. And you have a healthier home environment. Weight loss isn't just about aesthetics or numbers on a scale. It transforms lives, improves relationships, and gives you a better long-term well-being.
So as we come to the conclusion of this discussion about weight loss and the latest and greatest, let's go through our mnemonic that is weight off. And let's just review our guide for losing weight safely. W stands for what?
Watch what you eat.
E
stands for exercise regularly.
I
Include more fiber and water.
G
Get enough sleep.
H
Healthy habits, not quick fixes,
T
is track your progress.
and for the word off, O
Is overcome emotional eating.
F
Is follow up with your doctor.
F.
And focus on small, steady goals.
I do want to make this addition. There is something that happens with these injections. You will start losing weight for a couple of months and then you'll hit a plateau and you will not lose any weight for maybe 3 weeks. And this happens all the time. You cannot give up and say, oh, this isn't working. Focus on your small, steady goals. You just keep it up and then it will start falling off. So I want to thank you, Doctor, for this discussion. It's very close to my heart. And so I want to encourage those that are kind of wishy-washy about it. You're afraid and you're 300 pounds and you're not going to school or you're not going to work or you're not doing social activities. Give this a try. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. HELEN.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.